Hi, I am Janelle Friesen. I'm the Public Information Officer with the UGU Public Health Department. It is September 16th, and this is our COVID video update. And I'm back here with Juliann. Do you want to say hi?
Hi, everyone. Juliann Van Liew, Director for the Unified Government Public Health Department, and happy to be back talking with you all today.
We're always happy to have you back. And I'm interested to talk about our topics today. So the first thing we're going to cover is talking about COVID vaccines and people who are pregnant and what you need to know about that. And then we want to wrap up after that talking about how you were recognized as one of the 40 under 40 in public health by the Dept Foundation. So we definitely want to acknowledge that because that's pretty exciting. All right, so let's jump into our first topic though. So can you start by telling us, is the COVID vaccine recommended for people who are pregnant?
Absolutely. The COVID vaccine is highly recommended for people who are pregnant. It's recommended by the Centers for Disease Control, or the CDC, as well as ACOG, which is the American College of Obstetricians and Gynecologists. And these are two leading public health agencies. And they are really making that recommendation based on a lot of research that has been conducted since they started researching these COVID-19 vaccines. And that research is showing that these vaccines are not only safe for pregnant people, but they're really necessary because pregnant people are at much higher risk of getting severely ill if they contract COVID-19 and of dying from COVID if they contract COVID-19.
So can you speak a little bit more about the safety of the vaccine as compared to getting COVID? I know you touched on that a little bit.
Absolutely. And one of the concerns I want to address directly is this misconception that's out in the public about the ability for the vaccine to affect people's fertility. We have not seen that anywhere in the research. We're not seeing that people who have been vaccinated by COVID-19 vaccines using any of the manufacturers, so Pfizer or Moderna or J&J, are impacting people's ability to conceive a child. So that's one thing that's really important. Secondly, we know that these vaccines are incredibly safe. People are able to get the vaccine regardless of their pregnancy status and to do so very safely. They may still have those short-term side effects like the rest of us. They may still have, a mild fever or that sore arm, just like everyone else, but people who are pregnant can absolutely get the vaccine safely. And what's most important is that there is a much higher risk of illness and death from COVID than there is from the vaccine itself. Unfortunately, in Wyandotte County and here in the metro, we've seen a number of pregnant people pass away from COVID while pregnant, which really is just devastating, obviously, for these people and for their families. And so this is a very real concern. It's happening across the country, but it's happening here in our own backyard as well.
That's really tough to hear, but I'm glad that you are sharing that information. We've been talking about this in a really general way, but would you be willing to talk more about what this means to you personally?
Absolutely. This is an area that really hits home for me, and that's because I am almost 24 weeks pregnant, I believe, coming up this weekend. And carrying, hopefully will be my second child, and feeling incredibly lucky and blessed to do so. And the thought of me becoming seriously ill or just the extreme of passing away while pregnant is really terrifying. It's a very scary thing, especially as someone who already has one child who depends on me. And so as a person who is pregnant, I received both of my 2-dose series of vaccine before my pregnancy. It did not impact my ability to become pregnant or conceive in any way. And I actually am anxiously hoping for a booster shot here before the end of my pregnancy so that when I get that booster shot, I can pass on those antibodies to my child. And so not only was I willing and ready and happy to get it before I became pregnant, I'm also really excited to hopefully get my booster and provide some protection to my kiddo as well. So this is just one of those things that a lot of people in their life experience pregnancy or have people close to them who experience pregnancy, and it impacts so many of us. And that's why I'm really hoping that this can become a stronger part of our messaging from the health department.
Thank you so much for talking about that. I mean, I think that that's important for people to hear, not just what are the recommendations from a large agency, but also, what does this mean on an individual level for someone who, has relevant experience? I want to kind of wrap up this portion by reminding folks that you can find information about how to get vaccinated for free and other COVID resources at wycovaccines.org or by calling 311. Okay, I want to transition us for a moment to talk about how you were selected by the De Beaumont Foundation as one of their 40 under 40 in public health, their class of 2021. The De Beaumont Foundation says that they created the 40 under 40 in public health to recognize leaders whose creativity and innovation are strengthening communities across the country. You became health department director in the middle of a pandemic. You've been doing this for a bit over a year. You've had quite the start of being the director of our health department. What does it mean to you to be selected for this honor?
Thank you, Janelle, for those kind words. It's amazing and it's incredibly humbling, mostly because there are thousands and tens of thousands of public health professionals across the country who have just worked their absolute hearts out to serve their communities always, but especially these last 18 months. And so I'm just really happy to see organizations like De Beaumont give shout outs to people who are working in this field, doing this really incredible work. And for me, this isn't an award that really is mine. It's an award that recognizes the foundation that was built before me. It's an award that was only bestowed on me because of the team that we have in the Unified Government Public Health Department that's been able to help me achieve some of what I've achieved and realize some of the dreams that I've brought with me to this health department. And it's an award that goes to our community because, as we always say, the health department can do very little on our own. Our successes are only achievable when we're doing things in concert with the community, with partners, with community members, with other departments of the unified government. And so in my eyes, this really isn't mine, this is ours. And I'm just happy anytime we can see Wyandotte County get some recognition for some really positive work that's happening here that sometimes can get overlooked in the metro. And so I'm just very honored and very humbled and really proud of our team and what we've done the last year and a half.
All right, well, congratulations. It's well deserved. And you're right, we do have an amazing team. And, this work wouldn't be possible without all of the different folks who are involved. All right, well, let's go ahead and wrap up for today. Thank you again, and we'll see folks next time.
Thank you.